longevity doesn't start for people who are just 65, right? We could be starting to consider that when we're in our 30s or 40s. But there's a time to look at these issues and plan for them based on where you are, what your demographic you're in. But it's something that we don't do at all. And for the most part, it is women who are harmed by this lack of awareness.
When you're able-bodied, running errands, and tackling a lengthy to-do list, it's easy to label aging as a not me problem. You might even swat your hand away at the idea of getting older and mutter to yourself, that's so far away. Or maybe even, that won't happen to me. How can aging happen to you when you're too busy trying to make a life for yourself? You're building your career, bringing up children, and maybe even looking after your own aging loved ones. Aging, it's for others. You may think that you don't have time to get older, but if we have learned anything from residents in long-term care, it's that aging will always make time for you. Sometimes sooner than expected. And sometimes people need that support sooner than expected, which is why long-term care, as part of Ontario's publicly funded healthcare system, provides 24/7 nursing care for those whose needs can't be met safely at home. We launched Coming of Age 5 years ago with a goal to reimagine aging and better support seniors. Just as one might think that they'll never get older, we never thought Coming of Age would make it to season 5. So we thought, wouldn't it be great to take a pause for a moment and look back to season 1? Our very first guest on Coming of Age was Moira Welsh, an award-winning investigative journalist with the Toronto Star, who has for years covered stories about Canada's seniors. On her first appearance, Moira had just come out with a new book titled Happily Ever Older. 5 years later, she has a new book called The Astonishing Lives of Older Women. In 2021, we discussed the need for a human-first approach to senior living and how long-term care homes work every day to support staff and residents through compassion, expertise, and teamwork. We invited Moira back to take a look back at how the landscape of senior living has shifted over the last 5 years. What have we learned? What are we working on? And where are we headed as Ontario's 80-plus population is projected to nearly double by 2040? Special thanks to our sector champion, Point Click Care, who have generously sponsored this episode. I'm so excited for this chat. Welcome back, Moira Welsh. I'm super delighted to have you back. I have to say that I think I first met you in 2019 at our workforce summit at the Global Aging Network in Toronto. One of the things that really struck me when I met you there is just your curiosity and your curiosity around aging, and could never have predicted that 8 months later, we would be facing a global pandemic that preyed on older people. And how we saw that unfold in Ontario, Canada, really was quite devastating. And what I really appreciated at the time and during the pandemic was you didn't get mired in the data. You never lost sight of the people. And so many stories were about the numbers, and yet you brought a real sense of hope and optimism, and actually wrote a book called Happily Ever Older that really focused on happiness. And I have to say, you gave me hope in that process because it was a real diversion from what was happening on the ground and really spoke to what the opportunities would be on the other side. So as you reflect on 5 years later, I'm really interested in your reflections on what's changed. What is different now that we have the pandemic behind us?
I think that so much has changed. If I can just go back and talk a little bit about the pandemic, how that brought us to where we are now. I was still finishing my book when the pandemic began. I had started writing it earlier. And because of my research when the pandemic hit, as you noted about the stories that I did for the Star, I I I knew that isolation and loneliness were going to be a real problem for people with this lockdown. So I started writing about that early. And I think that was one of the points that a lot of people started to accept quite quickly and realize the same. But I think as 5 years have transpired, I think that we are all increasingly aware for so many different reasons of why the human connection within long-term care matters so much. And so a lot of people long before me have been talking about these issues, but I think that I'm seeing it more and more now. And what I find really exciting is that when I first did my first story for the Toronto Star was on Peel Region Home that transformed one dementia care household into what they call the butterfly program. And that story, when I did that, a lot of people were upset with me for doing that. And I didn't quite understand why. But as the years transpired, so many people are on side with those ideas. Not that specific program. It's not about a model or a certain philosophy, but it's about the concept of being open to a more natural way of living in long-term care.
Well, and I think that's the point, living. And I was in a long-term care home in Brampton, Burton Manor, and they have adopted the butterfly model. And I have to say, it was so interesting to see the evolution of the home and the life in the home. So there's technology, there are AI robots, there's a living classroom, the sense of optimism and energy in the home. And they have a sandwich program where the residents actually make sandwiches for a local shelter. And to see the sense of joy and possibility, as opposed to, I welcome your thoughts on this, that one of the challenges going into the pandemic in long-term care, certainly in Ontario, was that the homes themselves were isolated. And no one knew who was living in long-term care home. There was no awareness of who was working in long-term care home, no awareness of what the clinical needs would be of the individuals living in the homes. And it was almost this fear, even before the pandemic, of growing older and going into a home. Did you have that sense at all?
There's a doctor, a geriatrician in the United States called Dr. Bill Thomas, and he called nursing homes the house on the hill, the house that's isolated from everyone else. And nobody wants to go there because it's the symbol of fear and foreboding and isolation. And what we think is the message about aging. And it's all incorrect. But certainly if we build institutions that uphold that type of symbol, then it does become a self-fulfilling prophecy.
More recently, I would say in this season, I had an epiphany. We actually toured a home in another country, perhaps the Netherlands, and it seemed like a walled city. And I've spent the better part of my career working in the mental health sector, where I've literally been working to bring walls down and to open up the doors. So even as you talk about the Peel Region program to reimagine living in a long-term care home, how do we open up the homes so that we aren't locking people away and isolating them from the rest of the world so that that people don't want to see them at all? And during the pandemic, we locked everybody in and we also locked everybody out. Do you have any reflections on those images when we went in total lockdown around just overprotecting our residents?
I was speaking to someone about this the other day. There was a story I did on a man. I interviewed a man whose father was in a home. He was actually in a retirement home, but it was a retirement long-term care home in Toronto. And he was so isolated. His kids were finally allowed to see him through a door, but the home wouldn't open the door. So their father was brought in, and he had lost so much weight that he just looked like a little bird. He had little bird legs. And it was the saddest image, just the way the son described it to me. It was just so incredibly profound. And he will live with that image forever because he felt there was nothing he could do for his father, but he watched his dad just exemplify the impact of isolation. I also spoke to staff, and staff were incredible. And I think one of the things that I think was so profound in writing these stories was just the time that they put in and the connections that they tried to keep with the residents in their care. And of course, they're wrapped in PPE, and it made it really difficult to have that sort of human connection. But I think we learned so deeply and profoundly that people really need each other. And it seems almost trite to say that, and yet we've got so far away from that in so many ways, not just long-term care, but in so many ways in our society. And so I think that was a lesson that if you were listening and watching, you would have taken to heart.
And I think we have, if we can take some positive things out of the pandemic, it really shone a light on the fact that we had not valued our seniors. We had governments around the world had not invested in supporting our aging population. That where we know that one of the fundamental challenges that the homes faced that were one of the root causes for the spread of COVID in the long-term care homes was old infrastructure, old buildings, ward rooms, outdated models. That community spread obviously really mattered. And really thinking back now, what is the response to that? So in Ontario, we had a commission that was undertaken during the pandemic. The United Kingdom is just finishing their phase on social care, and they're a royal commission on what happened in the pandemic on social care. They're just doing it now. In Australia, they had already started Royal Commission around long-term care and changes around long-term care as the pandemic hit. And in the United States, we didn't really see those structured reviews. But Ontario did undertake a structured review, and there were recommendations made. There were legislative changes made during the pandemic. The Fixing Long-Term Care Homes Act, brought in by the Minister of Long-Term Care of the time, Rod Phillips, and they started making new investments in long-term care while we were still in the pandemic. And it's interesting to me because prior to that, with the previous election, with the election of Doug Ford as Premier of Ontario and his new government, one of his election commitments had been to rebuild the infrastructure. So 58,000 new and rebuilt long-term care spaces, which suggests to me that there was a sense that there needed to be some changes made to the infrastructure, and then COVID hit. I'm really curious, as we think about where we were and where we are today, I kind of marvel that the province of Ontario remarkably has done more than any other jurisdiction in terms of investments and supporting change in long-term care. Billions and billions of dollars have been committed to rebuild, but not just the buildings, the workforce and the care models. Do you think that there's broad awareness of the activity and the investments in change in the province?
Well, let me speak about the current long-term care minister, Natalia Kuzendova-Bashta. She seems to have quite an interest in small households, resident-first care or emotion-focused care. And so I know from speaking to a woman at the St. Clair O'Connor home in Toronto, East York, that they are actually building a small household. But hopefully, the woman said, her name is Catherine Schulk, it's in the process of happening. And so what I've heard from a couple different people is that this ministry is really interested in making some of those changes that others have spoken about for quite some time. And that's really interesting to me because for so long, change has been incremental. And if you're a journalist and you write about something, there may be certain amount of changes or promises, but we kind of step back and it's easy to sort of settle into the traditional ways. So it's incremental, but whether it's coming from the ministry or the homes themselves, there seems to be a greater awareness of the need for these type of programs, for more staff. I hope for staff with real training, because I think that's also a key part. When we spoke about that in the first podcast that we did together, how important it is that it's not just hiring people, but you hire people who actually understand the value of connecting, the value of relationships. And but I really do see that the system, in the sense of positive possibilities and pilot programs coming from the ministry now, are showing that there's an opportunity for greater change.
We've had quite a few ministers in our ministry. There's been a lot of rotation, and really admire Minister Kusundova Bashta, who is a nurse by training and brings a real clinical lens and commitment. So I was on a tour of a house yesterday with her, long-term care home, Burton Manor in Brampton, Ontario, and which has the butterfly model, but also is really incorporating technology, a living classroom, really innovating. We were giving out awards to residents who have been contributing to their local community. So it was really a day about community engagement. And it was really exciting, quite when I think back to the pandemic, when nobody was coming in, the deputy mayor was there, the minister was there, there were other partners, the individuals who do physiotherapy, pharmacy from the home. There was a real sense of the community of long-term care really as part of a community. And it was supposed to be, the minister spoke and was giving out these certificates to residents who were crying about the recognition. It was a really beautiful day. It was supposed to be an hour and a half. She stayed for 3 hours and took every moment she was asking really wonderful questions of the nurses, of the PSWs, the other staff within the organization. She always stopped to talk to the residents and family caregivers who are there. A real sense of compassion and empathy, but also she does have a real sense of purpose. So we've now have Ontario's achieved 4 hours of care, more so than there are other provinces, in Nova Scotia being one, where they're working towards 4.1 hours of care per resident. In Ontario, they've largely achieved a provincial average of 4 hours of care through investments of billions of dollars. They have nursing preceptor programs, PSW preceptor programs, extern programs for nursing students in long-term care homes now. During the pandemic, they did a wage top-up for our frontline workers. She's really committed to new approaches. So they've also invested in wound care and wound care training for frontline staff. I'm very hopeful and really see Ontario as being a leader in driving change and innovation. And one of the points I made yesterday, having been touring a lot of homes, is that we keep saying we need to look to Denmark or the Netherlands or another country. I actually think we need to look inside our own homes and be able to see the leadership that Ontario homes are really driving and owning in not accepting the status quo and really making things different for residents. Before I move on, I do want to ask you about your reflections from where you were when you were writing your first book and what's changed from today. I am really curious. You have often thought a lot about the stigma of aging, and you've written about a stigma of aging. Do you think that the pandemic actually has helped or hindered that stigma?
I think it's helped. I think that it has forced people and people in power to talk about these issues. The cliche goes, you shine a light on something, but when you shine a light for an extended period of time, people really are forced to take a deeper look and consider the issues. And I would say that has happened. I think many of us would want change to happen immediately. And that I'm in the media, so I want to write stories that lead to change, and I want to see it happen. We feel like we know what could be done. Like, for example, there's a pilot program now that the ministry is accepting applications for, and they will be focused on emotion-focused care in homes. And so there will be a number of homes that will be using this, which is a great start and a great way for the ministry to look at what kind of regulations need to change. How do you bring these programs in, or how do you change the regulatory system to enable people to live the way that we're talking about without struggles from the administrators of homes and the challenges? And so I think that is a really important change and step forward. But I don't think that would have happened if a lot of people had not started to talk about what was going on in homes or retirement homes or our community, frankly, because you and I have had conversations in the past about how to live well in the community. You have shared a lot of information with me on that as well. So much more widespread than just a nursing home, but they are regulated by the government. So if we're talking about that, I think that's really opened the door for consecutive ministers, and now with the current minister, to make tangible change. That's really interesting. So it's been 5 years, but it's happening.
I agree with you. The one thing that we're wrestling with, and I wrestle with, is there was almost this COVID overcorrection where we suddenly needed to protect our seniors, and this overcorrection on protection versus allowing them to live and live with some degree of risk, to your point around new emotion-focused models of care, and really thinking about everybody is part of the care team. We're all part of this community within a home, supporting a resident and living well. One of the things that I would argue it's time to rethink is this overregulation and this crackdown on compliance and this notion that all long-term care homes are bad. And so much of it is about, we've lost sight about what actually happened in the pandemic that made homes so vulnerable and what were those root causes. So how do we now step back and perhaps let go a bit, where we now foster greater trust with new models of care, with new approaches, thinking about the role of family caregivers, which I think there's even greater awareness of their function is, having come out of the pandemic, to perhaps find ways where it's not about compliance, and I always love the compliance issues that come out around dietary menus. And if you get an compliance order because you served carrot cake instead of Jell-O. And so where's the materiality? One of our core pillars as an association is, how do we restore public trust? And trust works on so many levels. We need our families to trust us. We need to trust our families and residents. The ministry needs to trust us. We need to trust the ministry and those who inspect us. But trust is so foundational. And we're feeling, as an association, we now have community engagement days. Once a year in September, community engagement day, where our member homes are inviting their community into their homes to see we're not that scary. Aging can be fun. And there's purpose in coming in and acknowledging our homes, and we're not so scary. So every year we go to the Association of Municipalities conference and host a breakfast, and I always ask, who's been in a long-term care home? So of elected officials, and it shocked me 2 years ago how few hands went up. However, we're seeing increasingly more and more hands going up to say, yes, I've been in a long-term care home. And I'm proud of that, and I accept that, and I want to be part of that. I think we're making progress, but to your earlier point, it is still incremental progress. But had it not been for the pandemic, I don't think that we would be seeing the progress that we are.
The pandemic made everyone talk about isolation and loneliness and understand, even younger people, right? People And so it wasn't just about growing old and being alone. It was showing that it's a condition that people feel. And if it goes on for an extended period of time, it can be quite debilitating, especially if you are older. But also, a lot of the studies show that people in their 20s also have higher levels of loneliness and isolation. But we started talking about that, and it became more commonplace to discuss. And then the discussion obviously moved into long-term care, and there were, I don't want to call them like simple solutions, but the idea that you can create a community within a home. You can bring in people. There are homes, there's the Sherbrooke Community Center in Saskatoon. They have grade 6 classes unfold there. And a lot of older adults who are residents, if they had a teaching background, they will get involved and help teach. They have arts, like an art program. They have a daycare. I mean, daycares are almost commonplace now in homes. So, but there are so many different ways when you talk about sort of showing that the homes are upholding the safety of the homes without certain regulations that kind of dampen the fun and the life of homes. I mean, having the community come in more often is one way of doing that. It's constant transparency. It's making people a part of the world, and the world sees what's going on. And that's what, when you mentioned the Netherlands, they have a restaurant within the De Hogevik, the village. I think they were planning, when I last spoke to them, they were wishing that they had opened it more to the public.
And that's my understanding. I was speaking with someone at the OLTCA, this is long-term care conference, and they were indicating that they're really thinking about how do they modernize, what's the next iteration of their model, and stepping back to think, okay, is this what changes and adaptations do we need to be making today?
Can I say something when you mentioned risk, living with risk? And I did a story about a year ago, and I have to say, I was so surprised to hear this, but I found it so interesting. The Schlegel homes were approached. One of them, I spoke with the administrator of a home in Guelph, and he was approached by a resident. I think he was just in his 70s. And he said he needed more fun in his life and more adventure. And so they said, well, what would you like to do? So as it turned out, he went skydiving. And then all the other residents wanted the same. And so they started taking the groups of people. Sometimes their children would come along and they would go skydiving, or doing the edge walk at the CN Tower, which the thought of which terrifies me. But people are off doing this. When I would tell people these stories, they seemed shocked. But I just thought it's the same thing. It doesn't matter how old you are. If you have that desire for that little bit of fun that comes from getting strapped onto a skydiving instructor and jumping out of an airplane, then why not? And so that's what they're doing.
And I think so many of our homes are really focusing on how do we support our residents in continuing to live, continuing to contribute to their community. So again, I love this sandwich program that Burton Manor had, where the residents are making sandwiches for the local shelter. One of their other homes, for Sister Homes, builds backpacks for the homeless and assembles backpacks that they donate to to a homeless shelter. Just because you move into a long-term care home doesn't mean that you don't continue to be able to contribute to your community. But this notion that you can move into a long-term care home and now suddenly you're not part of your community, I think that's the magic of so much of the innovation that's happening, whether that's through Schlegel homes, whether that's through People Care Homes, or through some of our larger nonprofit members. Rakai, the Rakai Center in Toronto, is building a new long-term care home with housing, and they're going to have life labs. They've partnered with the YMCA across the street. They're embedded in the Distillery District in downtown Toronto and really see themselves as being more of a hub where people can come in and access other services and supports. Minister Kusundova Bashta has a number of pilots to build out something she's referring to as community access to long-term care, where why can't you be living in your local community and come in for podiatry, or come in for a blood pressure test, or come in for dialysis, or access a pharmacy, or come to daycare, day programming for adults, but also daycare for kids. So you bring families in. And by bringing people in, you are actually fostering greater trust. You are actually enhancing quality within, because you're bringing more eyes in, you're normalizing life in a long-term care home. It's not so scary. And really rethinking that model, which is really exciting. At the home I was in yesterday, they have robots where they do karaoke with residents. You register with robots. The robots are actually monitoring for falls risks. And so you've got this AI function now that's coming into play. The families are using Alexa in resident rooms to communicate and connect in so that you still have that connectivity, which is something that actually started in the pandemic when we had isolation. Change is happening very quickly. I think it's being driven too by younger baby boomers who aren't going to accept the status quo.
I agree. The first wave of the baby boomers turned 75 during the pandemic, and they were not happy with their options as they sort of looked towards the 80s. And I think the younger boomers or Gen X are not going to have it at all. And so I don't want to say it's market driven, but certainly the people are speaking. And I think homes are probably listening. And I think homes, well, I'll ask you this question because I don't really know the answer, but there are probably a lot of younger people operating some of these homes now as well. And so with that, naturally comes a different perspective. What do you think that matters?
I think it does. I think we have a lot of fresh energy. And one of the staff in the long-term care homes prior to the pandemic was on average older than other parts of the home and community care and health system. And we had a lot of burnout. And our sense is that a majority of leaders at the home level, the administrators of homes, actually left the homes from burnout after the pandemic. We've had enormous turnover of the directors of care, the nurses, as well as of our administrators. So we do have fresh eyes and fresh ideas, and couple that with the commitment of the government and the new investments of the government to support new approaches, including making long-term care homes learning environments. So we've seen, I would say, the majority of homes now moving to more emotion-focused care approaches. Some of them are hybrid approaches. We're seeing new partnerships and new innovation that is happening, including with school boards, to your point, around classrooms, and new relationships within the context of local communities. So whether that's with a school board, whether that's with a Y, whether that's with a local chamber of commerce, it's really changing, where there seems to be more of a sense of a collective shared engagement around who's in the home and how are we going to support these homes. So that is a huge shift.
Yeah, a much different philosophical approach. Absolutely. It's really interesting. Can I ask another question?
Yes, of course.
I'm not trying to take over your interview.
This is like one of our breakfasts.
Yeah, that's right. Okay, so this is not necessarily about long-term care, but there are only so many spaces. I know the government continues to announce new spaces in new homes and construction money, but if you look at a population that's going to have a very large population of older adults moving forward, we should not forget that the first millennials will turn 50 in 2031, when 50 is not very old, but it's also not eternally young either. So time does pass along. So all of which is to say, how do we help people prepare for old age so perhaps the homes won't have thousands and thousands of people on wait lists, but people can survive more readily, maybe by taking advantage of the services that you spoke about within the homes, but still live outside of the homes, if that makes sense.
Our view is that aging in place means aging in your community, however you define your community. So whether that's a cultural community, a faith-based community, a linguistic community, or a geographic community, We're certainly talking a lot about how do we keep people in their local communities. We've done some polling with Abacus Research with David Coletto. We did a sample this summer of 7,500 people and asked them about their sentiments about the state of the system and expectations around how they expect to access care. They want care locally, in their local community. They want quality care and they want affordable care, where affordability means publicly funded. They're agnostic as to who delivers it, so long as it's publicly funded care. When we take those views coupled with the research we did 2 years ago on boomer expectations, and their expectations were that they would never need care. So the fact that even in this round, there's thinking about they may need care, but 2 years ago, I will never need long-term care. I'm going to be well, but also making no financial, what's consistent in the two pools is that there's no sense that they have any personal responsibility to plan financially for any care that they might have to pay for. So there's an expectation management challenge I think government's going to have in that the baby boomers and their families are expecting publicly funded care in their local communities. And how do we think differently about accessing that care? We know that over in 2027, which isn't that far off, the rate of growth of the population over 80 in Ontario alone will double. And we know about disease prevalence. Prevention is a little late for some of us in terms of, did we care for ourselves? Did we look after ourselves? So we know about disease prevalence and cancers and orthopedic pressures and cardiac pressures. We anticipate that there is going to be a peak, not only in that demographic, but in the demand on the overall health system. Even if the government of Ontario were to successfully build and rebuild 58,000 spaces, the wait list in 10 years will be closer to 70,000 people, just by virtue of demographics. So we do have an obligation to think differently. What are those bridges then with home and community care? How do we use technology to avoid hospitalizations and transfers? Can we keep people in their local community, especially in our rural communities? The idea of long-term care without walls or community access to long-term care. Why can't you have home care based out of a long-term care home where perhaps in a local community you're sharing a primary care team or you're sharing resources, or the physicians in a long-term care home can be doing remote monitoring. For instance, the Toronto General Hospital has a program that they've been building out with the Vector Institute where they're doing remote monitoring for cardiac patients. And Roxana Sultan was on an earlier podcast who talked about this notion that instead of a nurse case managing 40 people, they can now case manage 400. And it's through wearables, so they don't need to come in. I think that similar to the pandemic, we're very close to the point where this is going to be another crisis. It's going to force greater collaboration and more interdependence among parts of the home, community care, and health system. The challenge is going to be government and the silos of funding and contracts and legislation. But I do think that we have an opportunity to change that.
I love these conversations. So I have an idea. It's not to fix the structural issues that you are speaking of, but what if the government, if the Ontario government changed the Ministry of Seniors to the Ministry of Longevity, and meaning longevity and well-being. So instead of just talking about seniors, talk about how are we going to live a good long life and a good long healthy life, and talk to people about walking more or lifting weights, especially women, right, for bone density, because bone fractures are one of the greatest predictors of an early death or of a fragile existence, which cascades ever downwards. So what if there was a new approach from the government and that the kind of was pervasive throughout the systems, like the long-term care system, which could theoretically help people in the community stay healthier. But also just talking about health and taking care of your body so you don't end up on a wait list.
Well, I love that. And how do you incent that? So you see employers are already having health wellness accounts for their employees. So it's just not about covering off prescriptions, but you can have an allocation where you can give employees money that they can use against wellness, whether that's going to the gym, buying equipment for your home, whether that's investing in going floating in salt. Like, what is the thing that is going to calm you? And so much of it is about being more restorative, but also being more preventative. And I'm always fascinated by the structures of government and how the motives in how we name things. I think that's a great bridge, though, to your new book. But before I get to your new book, I have one question. You had started Happily Ever Older just before the pandemic, and then you finished it in the pandemic. Did you feel tension as you were completing it in the middle of in the pandemic? Like, what was your mindset in that? You've got this beautiful book where you're sharing these beautiful stories of aging and these really inspiring stories that are so full of hope and joy, and yet we were in a lot of darkness.
I was still editing, like in the final stages of editing when the pandemic hit. So I had already written my book, but my book didn't come out until 2021. The book writing process takes a really long time, and the editing process, when they go through all these different stages in the book world, takes a year or longer. Like, I thought it would be out in 2020, but it really came out in 2021. So I was done the book. And I remember saying, should I be rewriting this? They said, like, you really can't. So I I insisted that I write a foreword or just a sort of a few pages to say, we're now in the middle of a pandemic and this is what's happening. And so that's how it unfolded.
It was sort of synchronicity, though, because when I had the opportunity to read it, it brought me joy. All of these other negative stories were just so focused on bad things and the negativity around long-term care and aging. And yet your book comes out in that darkness, and I found it very uplifting. It was one of those things where, always looking to find some light, it provided light. So I want to thank you for that. So, and I looked to the editing gods and the publishing gods, where they told you not to change it and to continue with it, because I think it came out at a perfect moment. So I want to thank you for that.
Thank you. I appreciate that.
So you now have another book, The Astonishing Lives of Older Women, How to Create Pleasure Over Peril in Peak Longevity. So you had referenced longevity in that. Can we build a ministry of longevity? You have explored the lives of a number of women in your book. And it's really inspiring because you're talking about isolation. You're talking about some of the socioeconomic challenges, some of the gender considerations. So I'm really curious as to, it's a bit of a pivot from where you were around long-term care. What led you to writing more about taking more of a gender lens to aging?
That's a great question. And somebody emailed me, somebody who had read my first book, emailed me and told me about the challenges that women were having. And so I started to look into that. And I did a story in the Toronto Star in the spring of 2023 and looked at the gender pension gap and the impact on older women. And I was amazed at the readership analytics that we have. They're internal, but so many people read that story and took time with that story and then commented on that story. And I remember somebody told me about one woman who was an executive who broke down sobbing after she finished it. And it's not because she was worried that she was going to retire on no money. It speaks to a lot of different points in our lives as people and as women. Just the challenge as women live longer. on average, they live on less. And so it was a warning. But what really struck me was that I thought older women are reading this and they want to be heard. And we're not writing about them. And so I continued to explore it. And then I couldn't not do a book on it. It started to consume me. And I started to see it everywhere. I think sometimes we write about what we fear for ourselves. And so I just sort of became deeply immersed in this topic and the lives of the women that I interviewed. And I learned so much from women in their 80s and 90s. I can't tell you the wisdom that is life-changing when you just consider one's perspective on moving forward and living well. It was absolutely fascinating to me.
In your foreword, you say that your son was scared by the stories. What frightened him?
Well, I raised my children as a single mom. I would talk about just the challenges of all women, but I said, I was trying to teach him moving forward that things can happen in life that we don't expect. A husband or a spouse can die. For example, if you're not working, if you stay home with your children and you don't have a career to bounce back into, you can be in a lot of trouble, or you can get divorced and your financial situation changes. And you still spend a lot of money on your children because you want them to be raised. It could be a job loss. It could be anything, but it's just to try to prepare yourself for the possibility and be aware of your finances. I'm so grateful I have a very good job with the Toronto Star. I'm blessed. But I do think that he was aware. He had a greater awareness of life, and it scared him. It did. He said, I'm so uncomfortable hearing about this. I think that speaks to a lot of young people, and male and female, because I'm not trying to just sort of glorify my son, but I'm trying to say that I've talked about my book to a lot of young men, and I say, oh, you might not be interested in this. It's about the gender pension gap. And they're deeply interested in it. So I find that kind of compelling.
I find that fascinating. Starting to think about the generational divide. What awareness is there? How do we grow awareness? What I loved about the title, and then having read your book, is the word astonishing. And it plays on so many different levels. So on the one hand, there's the shocking reality of that divide and the conditions within which women are living and aging. But now on the other hand, you do touch on the thrill of longevity and the positivity and the hope in that. So, and these are incredible women because they're survivors. They move on, they continue to live, notwithstanding some of the barriers and challenges that they're up against. I loved that word. I found the weight of it. And I loved the women. And how did you come to choose these three that you've really focused on?
I interviewed Pat because of her organization and Senior Women Living Together. And she tried to find a solution through that and is a very hard worker on those issues, continues to be. And through that, I met some women. It was hard to get women to speak with me, I must say. There were other women I tried to connect with, but it's embarrassing to end up. You start out in life in sort of one part of society, right? You're staunchly successful in the middle class. And then you end up living in a tiny apartment in probably one of the worst areas of your community because it's all you can afford and you're alone. So it's very depressing for people, and people also never imagined that they would live that way or end up sleeping in their car for a period of time, which is increasingly common, I must say. I recently did an interview for a story I'm going to do in the Star, and a woman who broke her hip, lost her job, and had no other option than to stay in her car for several months and live in parking lots and sleep overnight.
I think it's really important that we find platforms to give women voices and to make it similar to aging. It's okay. It's okay to talk about growing old, but it's also, we need to be able to talk about what the challenges of aging are. And Dr. Paula Rochon, I know you spoke to Paula. always brings that gender lens. And we can't forget that even as we look at who's living in long-term care or retirement homes, they're largely women. To your point, women live longer. And you think about the burden of that. I know my mother never knew finances until my father became ill with Alzheimer's. And suddenly she was taking a crash course on how to manage money and look after the home and the maintenance of the home and other things. Talking to somebody recently where her husband's 85, she's 76. She's never managed money in her life, really afraid about what's going to happen when he's gone and what is her capacity going to be just to manage at all. And so even questioning, do I give somebody power of attorney today? My point with her is, why would you give up your agency? How can we help you look after yourself instead of you sort of feeling that somebody else has to do it for you? And I think we need to support women in not getting to that place, but understanding that there are a lot of women who don't have financial literacy, who aren't aware, and with those conditions around pensions and not necessarily having savings. And I do think it's timely, this book, because we know from our research that boomers have not planned financially for aging. How are we going to support those individuals? And what are their needs going to be? And how are they going to manage, recognizing that they are largely going to be women?
It's such an important question. And I do think, I spoke about an organization called Scottish Widows, which is part of Lloyd's in England. And they have a program to teach young women about financial literacy and about the gender pension gap. But, if we sort of go back to my desire to have a ministry of longevity and wellness, then why couldn't that group help support older women prepare for themselves, as you say, right? To keep your agency or to help women. Longevity doesn't start for people who are just 65, right? We can be starting to consider that when we're in our 30s or 40s. But there's a time to look at these issues and plan for them based on where you are, what your demographic you're in. But it's something that we don't do at all. And for the most part, it is women who are harmed by this lack of awareness.
Yeah, absolutely. If you could rewrite the narrative of aging in Canada more broadly, what would your headline be for that?
Oh my gosh. We have great headline writers, and I'm not one of them. But I would say, if I'm thinking about this as a possibility thinker, I would say talk to people, just be engaged in the world around you. And that's not a good headline at all. I will say my editors would change that if I put that on the top of a story. I don't think I've ever written a headline in my story that was held intact. But I think that's the point. The point is, yes, everyone's aging, everyone's getting older, but as much as possible, and again, anything can happen, but as much as possible, why not try to greet it with a body that as an individual, you can keep as healthy as possible. We're all different. We all have different issues. But if you try to face it that way, you have better odds of being part of the world and enjoying it. There's no reason why we can't look at being a 90-year-old or a 95-year-old and thinking we are going to be living a vibrant life.
Oh, I love that. It's about human connection. It's being in the moment. It's living and really focusing on the curiosity and connecting with others. And that's something that you've done so well, Moira, in all of your books, seeking out the stories of real people in their lives and shining a light on areas where we can do better, but also the areas where there are those who are doing things really well. So I want to thank you for your time, for your curiosity, for your interest but also for your really balanced and thoughtful view on long-term care, on aging, on women as well, and the role of women in aging and longevity. I love your hope and sense of optimism. Again, you were our first guest when we started our podcast 5 years ago. It's hard to believe. And we started the podcast in the midst of the pandemic because we wanted the real stories to come out, and we wanted new voices, and we wanted to bring voices that weren't necessarily being heard, and to be clear that this wasn't just something that was happening in Ontario, Canada, or Toronto, Canada. This is a global phenomenon. During the pandemic, one of the magical things that happened for us as an association, and we were able to leverage through this platform, was to bring the voices of colleagues from the United Kingdom, from Switzerland, from Australia, from parts of the United States, and voices like yours to really start trying to really drive the change in the discussion about aging. And so look forward to continuing to support you in sharing the stories that you're telling. And it's like that old shampoo commercial. They told two friends and so on. And we create a movement. So looking forward to continue to foster a movement with you. And thanks for your leadership and optimism.
Thank you. I really appreciate it. This was great.
This episode was generously sponsored by our sector champion, Point Click Care. Point Click Care is a leading healthcare technology platform enabling meaningful collaboration and access to real-time insights at any stage of a patient's healthcare journey. Point Click Care's single platform spans the care continuum, fostering proactive, holistic decision-making and improved outcomes for all. More than 25,000 long-term post-acute care providers and more than 1,600 hospitals use Point Click Care today. For more information on Point Click Care software solutions, visit pointclickcare.com.